Okay, so what actually happens to your body when you smoke weed? Timeline mode. Seconds 0-10, smoke enters your lungs. THC, weed's main psychoactive compound, diffuses into your bloodstream through tiny air sacs. Your heart rate starts to tick up as your body anticipates a stimulant. Minutes 1 to 5. Blood carries THC straight to your brain. It slips through the blood-brain barrier and latches onto cannabinoid receptors, mostly CB1, like a key in a lock. These receptors usually respond to your own endocannabinoids that regulate mood, pain, appetite, memory. THC hijacks that system. In the prefrontal cortex, signaling gets noisy. That's your planning and attention hub, so focus can sharpen on one thing or drift. In the basal ganglia and cerebellum, motor coordination shifts. You might feel loose, but your reaction time slows. The nucleus accumbens lights up, your reward center, releasing dopamine modestly. Not a fireworks show like some drugs, but enough for a dar 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 dar. What dar 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 the turning there dar dar durant star and violent dar. Fibiper dar 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 teen. Heart rate can rise 20-50 beats per minute. Blood vessels in your eyes dilate. Hello, red eyes. Bronchi in your lungs open slightly, but smoke can still irritate airways, triggering cough. Salivary glands ease off. Dry mouth. The hypothalamus gets poked, boosting appetite signals, aka the munchies. Minutes 15-30. Sensory processing changes. Time perception stretches. Minutes feel longer. Short-term memory takes a hit, because THC disrupts the hippocampus's ability to encode new info. Anxiety or ease. Depends. In low to moderate doses and calm settings, many feel relaxed. Higher doses, unfamiliar places, or predispositions can tip into paranoia or panic. 30-90 minutes. If you smoked, this is often the peak. Pain perception can decrease. Muscles may relax. Creativity can feel boosted, though objective problem solving usually drops. Coordination and judgment are impaired. Driving at any point in this window is dangerous. Meanwhile, your liver starts breaking THC into metabolites like 11-hydroxy-THC that also crosses into the brain and contributes to the high. 2 out of 4 hours. Effects taper. Hunger fades. Heart rate normalizes. Attention steadies. Sleepiness can set in as neurotransmitters rebalance. After 4+ hours, most acute effects are gone for smokers, though metabolites linger in fat tissue and slowly release. That's why drug tests can be positive days to weeks later. Short-term side effects you might notice: dry mouth, red eyes, increased heart rate, slower reaction time, impaired memory, altered time sense, anxiety, dizziness, nausea. Lungs, combustion products, tar, particulates, irritants, can inflame airways, leading to cough and phlegm with frequent smoking. Sleep. You might fall asleep faster, but dream recall can drop. With frequent use, some people get worse sleep quality on off days. Longer term, regular heavy use can lead to tolerance, your receptors downshift, responsiveness. Stopping after frequent use can bring irritability, poor sleep, and decreased appetite for a few days to weeks. Teens and young adults are more vulnerable. The developing brain is still wiring up the prefrontal cortex. Frequent use is linked with attention issues, memory issues, and motivation issues. If you have a personal or family history of psychosis, THC can increase risk of triggering episodes. Interactions. THC can amplify alcohol impairment. It can also interact with meds that affect heart rhythm, mood, or blood pressure. Bottom line, THC plugs into your body's cannabinoid system, rapidly reshaping perception, coordination, and mood. Peaking within an hour, fading over a few. The context, dose, and your biology steer whether it feels chill or chaotic. If you choose to use, know your laws, don't drive, and pay attention to how your body responds. If it's not treating you well, that's data. Talk to a professional.